It is Breast Cancer Awareness Month, and as you might have noticed, the NFL, among others, is supporting the cause by going pink. The Pink Fest starting with Monday Night Football, October 1st. But is the NFL going a little too far? Does it actually increase awareness? Well, here to talk about that and this special month is oncologist Dr. Andrea Silber, co-director of the Women's Center for Breast Health at the Hospital of St. Raphael in New Haven. So what's your take on the NFL doing all this pink stuff? Does it help? Is it too much, or is it possible that there's no such thing as too much awareness?
There is no such thing as too much awareness. There are still women in the state of Connecticut and throughout the United States who are not getting their mammograms. Yeah. Mammograms are the most important and the first line of defense when you're talking about football.
All right, good defensive line.
Preventing and reducing mortality from breast cancer. So despite the fact that there's a lot of pink out there, not everyone is getting the message, and it also helps raise money for important research.
Okay, and we're seeing it with some pictures here with NFL. It's literally head to toe with a lot of players. We have some video, I believe, of the Titans-Steelers game, or at least from before that game the other day. So obviously it's gotten a lot more people conscious of this. How effective, you were talking about how it does help to raise money for it. How effective is it in terms of, do we need to spread it more into other sports, or what other ways can people use that pink to move it ahead?
Well, one of the things that I think is so important about the NFL being involved is it points out that breast cancer is something that affects the entire family. Mm-hmm. It affects the woman, or, sometimes there are men with breast cancer as well, but once someone is diagnosed with breast cancer, the son, the father, the husband, mm-hmm. the brother, the friend, all are affected.
That's true.
So it allows men to participate in something, and whether it really makes an impact, everything makes an impact.
All right. Well, and it is certainly, I think, has brought a lot more awareness to men. Because guys love watching football, so many of us do, and let's face it, I mean, for me, speaking for myself, it's a lot more front of mind than it was before that all started.
While you're sitting there and watching TV,
yeah,
you see the pink and remind the woman in your life to go get a mammogram.
Yeah, and speaking of mammograms, so you're talking about how a lot of women in Connecticut still don't get them, and that is still the most important means of prevention. What should women know?
Women should know, starting at the age of 40, they get a mammogram every year, and mm-hmm. for women who are diagnosed or who are identified as having as dense breasts, which are something that is identified by the mammogram, they can also get an ultrasound or an MRI as part of their screening.
I see, interesting. And are the mammograms helping more and more women doing it? And also, I'm just wondering, is there any contention? Are there women who say, no, there's some reason why I don't want to? Is there sort of that kind of a battle?
There are some women who are either don't believe in mammograms or are worried about the pain or the anxiety. And that woman should talk to her health professional, because sometimes there are things one can do to either minimize the pain mm-hmm. or minimize the anxiety. The 3D mammogram, which we have over at the Smilo Center for Breast Health, it's a little less painful, mm-hmm. and I think in the future we're going to see less discomfort, but the momentary discomfort should not dissuade someone from doing what is important for their health. And
maybe something that would help for guys to understand, maybe you can help me understand a little bit, how painful is it to get this exam?
It's not so much painful, but it's kind of like they squeeze, they turn the breast, they have to squeeze it to get a good picture, and that can be uncomfortable. And sure. I think since I'm on TV, I'm not going to say the analogous situation.
Yeah, well, but for guys,
right.
I was thinking the same thing. I was thinking there's probably some things that we can relate to and go, boy, that wouldn't feel too good. It might not be ridiculously painful, but not our favorite moment on a given day.
Right. But I think it's important for men to get the message out that despite some pain, mm-hmm. anxiety, or embarrassment, there's nothing to be ashamed of, to be checking yourself and making sure that you're healthy.
Well, if it keeps you alive, of course, and prevents something, early detection, we always hear, is still the best defense.
We've done a very good job with new drugs and new ways of detecting breast cancer and also treating breast cancer, but still screening is really important. You don't wait for symptoms.
And it's easy to get screened, I would imagine.
Easy to get screened, and for women that have no insurance in the state of Connecticut, for uninsured and underinsured, at our Yale Care Centers and at the Women's Center for Breast Health, we have mammograms for those women, so cost should not be an excuse.
So important to know that. I didn't know that, and that's fantastic. I hope that helps a lot of people out there. One quick comment. We're talking about football. Your son says?
Go Jets!
All right, he's a Jets fan. Had to get that in for your son. Oncologist Dr. Andrea Silber, thank you so much for being with us this morning. Very useful information.